maybe.
Oh, is that on?
It is now.
I was talking about the stick.
I just turned it on.
Uh-oh.
You're good.
We're on now. It's 6:30
Okay.
now. Okay, we're ready to go.
Hoist the sail.
Should put some in water.
Call the meeting to order at 6:30. Minutes from the previous meeting. Any corrections?
I make a motion to approve.
Second?
Second.
All in favor?
Aye.
Aye.
Minutes have passed.
Board of Health work session, we have 2 items, both septic related. The first is a discussion of use of innovative and alternative technology in Zone 2. An engineer brought this up a few times. A few different engineers over the last several months have approached me to ask if the board would reconsider their groundwater protection regulations, which prohibits the use of alternative technology in order to gain bedrooms or flow in a drinking water protection district. So right now, Title V allows you to get a credit of 110 gallons a day or 220 gallons a day, depending on the technology, to credit that amount for using nitrogen reducing technology. So for instance, if you have a 20,000 square foot lot, you're allowed to put on 2 bedrooms. It's 1 bedroom per 10,000 square feet. Harwich doesn't allow you to put a 3rd bedroom on with the use of IA technology. The state does. They say you can put on this nitrogen reducing technology, which has been proven to reduce your nitrogen to 19 parts per million rather than the 35 out of the pipe.
Pressure dose system?
No, they're not pressure dosed. There's probably 50 different technologies now. They are an insert or an additional part of the septic system that's usually underground. Some of them are above ground, and they have
So it's like a secondary recycle.
secondary treatment, yes, and they have bubblers or different moving parts that reduce nitrogen. And when they first came out in the early 90s, they were monitored, and the Barnstable County had their test site, and they test them often, and they still have that test site where they're testing new technologies all the time. But there's the tried and true ones that have been around for dozens of years that we have 20 years worth of technology data on. And so we know if they're operated properly, they will meet their target reduction of nitrogen of 19 parts per million or less. So back in the 90s, the town of Harwich had a moratorium on IA technology, and they said we don't want to use IA technology for that purpose because we're not sure if it's reliable. We don't know what our wastewater plan is in the future. But now we do. Now we have a comprehensive wastewater management plan, and we know where our damaged estuaries are, and we have the sewer plan also. So we also have Barnstable County running the IA technology program. So all the towns had to sign up, including Harwich, that said if you have an alternative technology, the wastewater operator is required to submit the results to the county electronically. And they have a permanent staff member that checks on them. They have a list of all the technologies in every town, and they have a database that flags a system that's more than 30 days overdue for a sample, flags when a sample is over their reporting limits, and flags when a operation and maintenance contract is out of date. So that's something we didn't have back then. Back then, a system could go in and would allow that extra bedroom, and then who knows what would happen. They'd shut the system off, and we wouldn't
Never hear from them.
hear from them. We had no tracking back then. So it's something that I wanted to bring to you because I'm not sure if there is a downside to it. And I wanted to know your feelings on it.
I have 2 questions.
Yes.
Number 1 is, now that we have this whole sewer plan, and we're gonna go into that, why would we necessarily need it? And number 2 is, if the system fails at someone's home, or on someone's property, they've already got the room. I mean, yes, they're being tracked, but what's the reinforcement, or what's the, I don't want to be punitive, but how, if they're unwilling or unable to rectify it, and they already got the benny of having an extra room, how would that be handled? So it seems to me to be an extra burden for the Board of Health or the town to have to be paying an extra salary and an extra monitoring system, unless there's a really well worked out plan as to how that would be monitored. You already talked about being monitored, but then how does that
What
get
happens?
rectified?
Right. To answer your first question, there are some areas that are in a zone 2 that aren't being sewered. So, this would mostly affect those areas, the areas that aren't being sewered. The areas that are being sewered, when the sewer regulations were adopted in 2015, they used flow data from those times. So at that time, we didn't allow this extra bedroom. So the sewer regulations, as they're written now, don't allow for an increase in flow if we were to adopt new regulations, because they refer back to an older date. So even if we say, yes, you can have extra bedrooms with IA technology, it still won't affect the ones that are being sewered. They're still stuck with their existing flow.
So it's really to the advantage of the people who aren't being sewered, or
How you gonna take it
disadvantage.
How are you gonna take it away from them? If you granted it to somebody, then they're
Yeah.
stored.
Well, we haven't granted it.
Right. But if they're tied to, say, a 3-bedroom house, and now we're gonna let them put in 4, then they put the storage in.
No, we wouldn't let them put the 4th in.
Okay.
We would have to designate whether we wanted to allow this IA technology to allow the extra bedroom where it's being sewered, because the sewer regulations don't allow for it now. So we right now, we're not allowed to give someone an extra bedroom with IA
I gotcha.
in a sewered area.
But back to his question, if they are in the sewered area and they, that's right, so it wouldn't really, it really wouldn't fail. If the sewer fails at their house, it's really not an individual property problem, it's a town problem?
Right. Well, there's two components of the sewer system. The town-owned part, which is in the road, and then the owner is responsible from the connection to the house. So if that line were to break or back up, that would be the owner's responsibility, just like if their septic system was to back up.
So how does that get rectified if they are financially unable to, let's say they're on a fixed income, or they're really a fragile elderly person?
Mhm.
If they put something on, but they're not able to, for financial reasons, not able to rectify it, how would the town intervene?
Are you talking about IA technology now? Well, if someone were to put IA technology to gain the extra bedroom, and then after a few years of monitoring, we notice that the system isn't doing what it should be doing, part of the contract is that they are to maintain that system or get a different system to get that 19 parts per million. So they would be responsible for putting in a different technology.
Well, it's at the cost of it. Weren't we
Yeah.
saying that,
Yeah.
oh, it's not you, someone else I know, who was telling me that in Eastham, when they put their system in, and I'm not saying ITA system, but they had to go with individual, it was the alternative if our town hadn't voted. And he said he paid $22,000 for that. So if you're talking like an 85-year-old and their system is failing, how do they come up with $25,000 or whatever to fix it? I mean, what would the town do to just make sure that it was
Well, the cost of that is probably the cost of the technology and the rest of the system and the installation of it. And when you say a system fails, it could fail for a variety of reasons.
Yeah.
The leaching field could fail, so the technology could still be working.
Oh.
So,
The county has a loan program too, like say they don't have any money, the county can lend the money, low interest rate for 30 years or something
Isn't
like
that
that.
just for sewer hookups, though?
no, it's
No.
for any failed
can use
system.
Title V system, you can get a Title V system.
Is this being pushed by the Realty
No, it's not being,
Association?
it's been brought to me from,
Builders.
engineers that have small lots that want to build on 10,000 square foot lots. So,
Huh. Do we really want them building on 10,000 square? I wouldn't think so.
or the houses that are 2-bedroom houses and all their neighbors are 3 bedrooms and they want the 3rd bedroom but don't have the land. And they don't want to go forward with the nitrogen aggregation plans, which are available at a cost. You've got to hire a lawyer to do all that information, so.
To do the credit swap
The credit
and buy
lands.
the land.
And buy the land.
Mm.
Mhm.
And what does legal say, our legal department? On
Yeah,
this? Do
I
they have an
haven't-
opinion yet?
I haven't brought this to them. I wanted your opinion first, if it's something that we should even pursue. If
It's
it's,
complex.
what's that?
It's complex, seems
It
to me
is,
to be pretty
yeah.
complex.
Yep.
Can we table it and talk about it next week?
We can. I think that's a good idea.
Well, you're gonna be
Next-
here by yourself?
Yep.
Next month? Yeah, we'll keep it on, and so you guys can mull it over, and feel free to ask me questions over the next month if you want to email or call or come in, and we can talk about them.
And would we, I don't know if this is typical request or not typical, but to better educate, I'll speak for myself. So to better educate me, I won't speak for the rest of my colleagues, is it appropriate to have somebody like that, Peter DeBaca, to come, somebody who's been involved with the whole sewer study, come in and give us a little 101 on the pros and cons? Because I don't know if I feel educated enough to make a objective, transparent decision on this without having more knowledge. Knowledge that I can understand, not necessarily by an engineer, but by somebody who's looked at this issue long-term and can objectively present to this committee. I don't have anything against realtors, my sister's one, but I would rather have somebody who's doesn't necessarily have anything to lose one way or the other, whether this goes through or not.
So are you looking for information on the technology and how reliable it is, or what the build-out consequences is?
More the build-out consequences, I think, for Harwich.
Okay.
And then is there any impact of that on all the work that the town has already done for the sewer? You know, is there any pros or cons of to all the work that's been done and recommendations made for the upcoming sewer system?
Okay. All right, I'll get some information on that and see if someone can come and talk about it. Then the next discussion we have is on the upcoming sewer implementation. The town is voting in May to yes or no go forward with the Phase 2 project, which entails sewering about 600 properties in the East Harwich area. The Board of Health is talked about a few times in the sewer regulations. The sewer regulations were adopted by the town in December of 15, I think it was. And the Board of Health is named as the enforcement board and the board to send out notices when it's time to hook up and give leniency or variances for hardships if someone can't meet those timelines. So what we've got to discuss and talk about are things like the regulations state 1 year from availability to hook up. The town of Chatham allows 2 years. Is that something we want to talk about? Because there's a limited amount of installers who are doing this work. And right now in Chatham, they have given people a year to do this, and at the end of that year, the homeowners say, I'm trying, but I can't find someone to do it. And then there's other questions like new construction or systems that are newly installed in the Phase 2 area. Will we make them hook up in the same timeline? If they have a brand new Title V system, should they have to hook up immediately, or are we gonna allow a sliding scale? Some other towns have thought about that and have worked with homeowners on, okay, your system's only 3 years old, we're gonna give you 5 years instead of 2 years to hook up, but you have to hook up. Hooking up isn't the question, it has to be done, but can there be some kind of timeline?
Yeah,
There absolutely should.
Yeah,
it'd be a shame for somebody to just spend thousands of dollars on a brand-new system and then have to throw it away, is that
Yeah.
and then the other question is a failed system because of a real estate transfer, and it's failed because it's a cesspool or because it has hydraulic failure, which means it has been full at one time but is actually operating decently. We have to, the board's regulations say those have to be upgraded within 45 days. So if the sewer is gonna be available in 3 years, can we give them a waiver of some sort that says, you can continue to use this system, it needs to be pumped every 6 months or whatnot, and then you have to hook up as soon as the sewer is available. So these are all questions.
Yeah, let me, if I can add to that.
Absolutely.
It's a good summary. You know, the previous discussion, we actually haven't been focusing on IA at this time, we've been focusing on sewer. IA is a little different category. You know, we have a wastewater support committee that's actually meeting tomorrow night. We want to educate them, we're trying to get more information out. But in fact, I hadn't read the agenda that I asked last night at the Board of Selectors meeting with the Board of Health. You guys come and let us know some of these policy issues, because things are, you know, we're going to start sewer in 3 years if we pass the town meeting. But there's real concern on policy issues, on regulatory things, you know. Who's going to provide the permits to hook up? What happens, you know, now the IMA for Chatham calls for a definite completion date, which is 3 years. I was talking to the Chatham representative this morning at the Wastewater Collaborative, and as Megan, you mentioned, unfortunately, they're planning on doing their next phase the same time we are. We have 628 homes we want to hook up. There's no way in hell, basically, that we can all work together to do that. So we're going to have to work with Chatham on the IMA to get an extension on our guarantee, but we're already talking about that. The people, and the point that you mentioned, we were talking this morning about too, is it'd be unfair to have someone put in a new system. Now, I live in the area that's going to be sewer. I wouldn't be happy about putting in a new system and then go 2 years or 3 years down the road. So I don't know what the policy is, but I'm hoping that, you know, you'll start those discussions going forward. We've had a lot of discussions in that committee on, I think you mentioned the funding issues, because we can use the county program. But there's a small percent of people, I don't know what it is, and everyone's going to complain about taxes, I am one of those. But most people can, you know, can dig up you know, pay for, say, $10,000 for connection, what it's going to be. There's a small percent that can. We're asking, we're trying to coordinate some bankers to come in and see if there's some low interest rates that can go on. Some tax, you know, to do now for seniors. to try to help that out. But it's easy to, and I've gotten a little discouraged, some of our consultants, it's easy sometimes to blow off my neighborhood that, you know, calm down, it's 3 years down the road. But people are looking for answers now. You know, and it's critical for town meetings, for some comfort that there's going to, you know, you guys and the town as a whole are going to be working with them to try to solve these problems. So the faster you can move and sort of sketch out some the tough discussions.
And what about if someone flatly refuses?
Pardon?
What about if somebody refuses?
The town has, we hate to go that way, but we do have powers on tax liens and stuff. We can go after and hold them to that. And the problem we have is that, you know, we're only suing about half the town, I say only, overall. And that works because our goal is not normal, you know, removing bugs and stuff for disease protection, it's remove nitrogen. So we can sewer half and get the amount of nitrogen we need throughout the system to improve our bays. That only works if that half ties in, with no exceptions. You know, you can, if you start letting people out, so that's a firm part of the sewer regulations that Megan mentioned that we signed on to in our agreement with Chatham, so we'll have to hold them to the, but that doesn't mean we're not compassionate. You know, we need to give them some time and some understanding. You know, my neighborhood, I think they're very smart people. They're, you know, professionals, but they're not plumbers, they're not electricians. They really need some comfort, and some of it comes from the committee, some of it comes from you guys. And, you know, what's the mechanism of hooking up? You know, they have to hire an engineer to draw the plan. You know, the digger, utility, I can't get the term right, where you call these people to actually dig the trench.
Utility line, something, yeah.
Whatever you call them.
Companies?
But electricians and plumbers, they're trying to understand the comfort level of doing that. And I know my neighborhood is already talking about trying to band together to get some organization in place. But those are all things that you can help on, because they really, I think, fall in your preview of the regulatory and how you do it. What the regulations going to be to get started. And so I'm really anxious, and I said I brought it up at the last night's meeting to get a follow-up report from you guys. Now's the time to start. You don't have to answer all those questions, but you need to let people know that it's in the process. You know, that you understand their concerns and you're answering those questions how to move forward. So I applaud the discussion. The INA, by the way, Megan's exactly right. And actually, it continues today. They work well. They can work well if they're maintained and monitored. You know? If you look at Georgia's data, unfortunately, they're very variable yet. They're getting better over time as people look at it. But that is another, my view has always been that the county should hire someone to monitor this, because they can do all the towns, where we don't have the resources, we don't have the knowledge to do it. The county hasn't quite bought into that suggestion.
Well, they have hired someone to monitor them by
Look at the
computer.
database.
Yeah, to look at the database,
Someone has to go out and
and
look
check
at it.
them. Yeah, no, they're not doing that
And
yet.
I've been arguing they should provide that service as well.
Mm-hmm.
Because they, you know, there's no individual town in the Cape that has enough of those to really merit hiring someone to do it.
No, no.
But if you were to combine,
Mm.
you know, the Cape, you could do it.
You bring up a lot of great points. I think that the idea of staging some of the work for the people who have just put a new system in, or even if you're thinking about buying a house and you know that within almost an immediate time, there's more money that you have to put out to get your house up to snuff. But I also don't think I like all what you're saying, but so I have 2 points. One of them is, since there's been a huge struggle to get the employees of the Board of Health fully employed, you know, the additional person that you just hired, how, I think that the town needs support. I think the Board of Health, this isn't us because we're volunteers, needs this to be budgeted so they have adequate staff to do it. And I would trust the Board of Health personally to be more objective and transparent than I would from the company that's putting it in, because they have more to lose, and there's not as much transparency. You don't want to be a negative person, but whatever. And I think that your comment about people can easily come up with $10,000, I don't really agree with that, because I guess you'd say involved, or have given a lot of thought and about hunger on the Cape, and the numbers of people who are going to the family food pantry going up. So if
Don't get me wrong, I didn't hope I didn't imply that. What I'm
No,
saying, most people in our neighborhoods, but I don't know what the level is, if maybe 10% can't.
yeah,
But if you look at even the county loans, 5%, which I think is, I'm looking for alternative, because that's high.
yeah,
But that's a 20-year loan, so if you're
Well-
looking at that brings it down to maybe $250 a year or so.
mhm,
I'm saying there's not that many people who can't afford that. But there are a number of people that show up at our meetings that really are the category you're talking about.
mhm.
And we need a better solution for them.
I'm not saying give it away for free, but I think we need to think about all these financial
Yeah.
responsibilities for folks, and definitely there needs to be, and what do I know? I'm not on the Board of Health, so I would think that they would need extra staff, and I would think there'd need to be extra legal assistance for the Board of Health, so that when these cases come up that are challenging, like the easing of folks with newer, older systems, or if people can't pay it, or they refuse to do it, whatever the reason, that the Board of Health has availability, and maybe they already do, but we're talking 600 homes. There may even be a temporary need to have more legal counsel for the town to be able to work through some of these cases.
Well, the town does have legal counsel who comes once a month now, so I have access to legal counsel once a month. It's a standing appointment, so
Would
we
that
don't have.
adequately, that be an adequate staff to deal with this?
Well, I'm not.
I would argue, if I may, I would argue the way to minimize some of the legal concerns is how we get ahead of the policy issues.
Yeah,
So you describe what you're doing and how you're doing it.
yeah,
And so people fully understand that.
yeah, I agree with
And
that.
That's what I'm pushing you to have good discussions on and, move ahead on that.
Have a good public relations campaign and town meetings and the
Well,
like.
understanding, it's easy to think that, consultants are engineers, so they take it for granted that people know what a grinder pump is. Who knows what a grinder pump is?
Yeah.
And I'll
I
just,
mean,
yeah.
I'm beginning to know.
And I'll just add one other personal point. It has nothing to do with this system, but my husband and I are doing renovation on our house, and they're supposed to be done at Christmas. And what's the main challenge for us to get this work completed? It's trying to get the plumber, and our plumber, not that we hired him, but our contractor did, was on call because of that horrible weather we had. So we had a number of days that our work has been held behind because there's not adequate plumbers on the Cape. And when we have a winter spell, and they're on emergency all the time. So I think that another possibility, I mean, this is like way removed, but we should be talking to the tech school and whatever. I mean, this is a terrific field for young people to get involved in. There doesn't seem to be adequate plumbers, that part of the system, and that's what might be a terrific support of emerging young adults in our community to think about this field.
We're passing back and forth with various committees information. Let me be sure you have that and you can circulate to
Sure.
from the county. A lot of it's available, you probably already received, but some of you may not, from the county, different sources and stuff.
The lists of all of the approved.
Oh, no, not that, yeah. I'm just talking general basis of what other towns are doing, we're collecting that now.
Mm-hmm. A lot of it's on the Wastewater Support
A lot of
Committee.
some wastewater side, we're trying to upgrade that all the time.
Mhm. So the Wastewater Support Committee is meeting on Thursday night at 6 o'clock.
Is that over there?
Over here, they're meeting, because we're all anxious about making sure the town meeting's coming up, we're actually now meeting 3 times a month. They're hard working group.
Mm.
We met 2 Tuesdays, twice a week in the morning, twice a month on Tuesday morning. I think it was 2nd and
Third.
Tuesday.
Second and, the first and third Tuesday, so they're meeting on Tuesday the 20th,
At early,
8:30.
8:30. And then they're holding one meeting, one for 6 o'clock for those people who can't. And they're also televising
Mm-hmm.
on Channel 18, so you can watch it.
And the charge of this committee is more public relations than policy.
Oh,
It's,
good, okay, so they have that.
Yeah. We had the committees before it came up with the CWMP, which is the planning, and they did a great job on that. But now we're in the construction phase, the feeling was that that's no longer a voluntary effort, that's the town.
Mhm.
You need people to know,
Mhm.
professionals. So Megan, you said now they switched their role into public relations, getting ready for town meeting, warrant articles. They're trying to learn to be sure the technology information circulates, they're keeping track of that. They'll try to keep our feet to the fire that we're meeting the deadlines that we're committed to. But with that, I think it's
Well, thanks for the invite for tomorrow night,
Yeah.
but whoever planned that date.
It's Thursday night.
Oh,
not tomorrow
Thursday,
night,
that's
yeah.
good, because I was gonna say, if it's tomorrow night, they're certainly not very romantic people. If I went to a meeting on Valentine's night about sewers, I think I might end up as a single woman.
Yeah. So if any of you
I'm not
do
gonna touch that.
You know?
want to attend start attending that committee, you're welcome to. If more than one of you want to go, we need to post it as a meeting, so we need to know ahead of
Can
time.
you tell us the official name of it again?
Wastewater Support
Oh, yeah,
Committee.
yeah. Is that the one that Peter DeBaca is on?
He's not right now.
Oh.
The members are Sharon Frister, I think,
Mhm.
she's the chair. Peter Hughes is on it,
Oh, yeah.
Chris Harlow, Ann Howell, and Marie
Oh, yeah.
Donahue.
They did a beautiful job
It's a great.
for us, and they did a beautiful job. I had them come to the Chatham Harwich newcomers and present, and Mr. DeBaca did a beautiful job.
He did a great job, and he's helping out on communication.
Oh, good,
And I'll be going on Tuesday morning, so I'll be able to
Right.
good.
hear
Okay.
what their concerns are and
Inform
relay
us.
them, yeah,
Thank
relay
you.
them back.
Thank you.
Okay?
We're
Thank you.
pleased to have you on Tuesday morning.
I'll be there. Bells on.
That was very enthusiastic.
It is 7 o'clock. The engineer for the first hearing also has a planning board meeting next door, so if we could bump him to second, take him
Okay.
out of order.
So I'll open the hearing on Hutton 437 Route 28.
Mhm.
Am I right? Is that the gas station?
It's behind the gas station.
Oh, okay.
So we have a hearing for Hutton 437 Route 28 to consider variance request to install a new Title V septic system prepared by J.M. O'Reilly and Associates, Inc. Variances from 310 CMR 15.211, minimum setbacks to allow a proposed soil absorption system to be 3 feet from the property line where 10 feet is required. Variance is 7 feet. To allow a soil absorption system that does not meet the required slope distance, liner and concrete block wall provided. To allow a 25% reduction in the soil absorption design flow. To allow a 5-foot removal is not proposed. Only the soil being completely directly below the soil absorption system will be removed. And to allow a proposed soil absorption system to be 85 feet from the wetland resource where 100 feet is required. Variance request of 15 feet.
Over to me. Matt Farrell, representing Andy and Katie Hutton. This is an existing commercial building on the south side of 28. It's basically directly behind Cumberland Farms and kind of in the back parking lot of the Harwich Land Ho.
It's not Cumberland Farms.
No.
It's not Cumberland Farms?
No, it's a gas station. I don't know what it's
Save-On.
called.
It's called
Okay.
Oh, yeah,
Save-On.
next door.
I was thinking Cumberland Farms, but I could be
It
wrong.
looks like a
I'm
very
trying to
old,
picture how they got mixed
Yeah.
up.
looks
And the
like a
Dairy
very
Queen's
old.
there, right?
Yes, next to the Dairy Queen.
The property is served by 14,400 plus or minus square feet and an existing steel building. It is in the buffer zone to the bordering vegetated wetland that surrounds the property on the east and south sides. The project has been to conservation and was approved. So the proposal is to upgrade the sewage system to a 1,500-gallon septic tank, a 600-gallon pump chamber, and a pressure-dose leach chamber located in the northern corner of the property. As Megan went through, we're seeking 5 variances. Should I go through them again? Yeah, why not?
Yeah.
The soil absorption system is not 10 feet from the property line. That's the northernmost line. We're holding 3 feet, seeking a 7-foot variance. The soil absorption system does not meet the side slope distance. It's supposed to be 3-to-1 slope around a raised system. So we're proposing a vertical concrete wall and a 40 mil liner on the inside of the wall so that no wastewater will break out of the containment wall. The soil absorption system is not designed at 100% capacity. We're holding 75%, seeking a 25-foot variance. Variance 4, the soil removal, we're seeking a 5-foot lateral soil removal variance. So the poor soils will be removed directly below the leaching facility, but not 5 feet around it. And then variance number 5, the soil absorption system is not 100 feet from the bordering vegetated wetland. We're holding 85 feet, seeking a 15-foot variance there. I guess there was some comments and questions from the Conservation Commission when we went through conservation that why are we not rotating this leaching facility so that it's parallel with the front line. And there just happens to be a driveway there for access to an overhead door on that side, so if we rotate it, it would block their entrance. We'd also across the water line, would have to replace that. So I guess at that, I'll open it up to the board for any questions, comments.
I don't see anybody from the audience to make any comments. I close the hearing.
I noticed that a lot of force mains now are being made out of PVC, and having been a victim of a ruptured PVC water supply line at one time, which caused a lot of aggravation, what guarantee do you have with a PVC force main that it will be properly maintained and or prevention of rupture?
Well, when you say rupture, you mean blowing up from the internal printer?
Either at the joints or cracking of the plastic itself.
Mm. Yeah, all I can say is that the piping from the pump chamber over to the leach field is at a minimum Schedule 40 piping, which is H20 rated, and, you know, we do an inspection, a wet inspection of the pumps to make sure that it doses out to the leach field, and that's about all we can do.
Have you had, in your experience, have you had any rupture to PVC piping in a force system?
Right now, I can't remember having dealt with it, but I'm sure sometime in the past, probably.
And what's the remedy?
Yeah, it would be to dig up and replace the pipe if you have a rupture in it.
Okay.
Unfortunately, it would probably fail slowly, so you'd never even know that it was leaking or ruptured until it really ruptured, which
Yeah.
sounds like you had some experience with that.
We're just talking about a shortage of plumbers, though, and I was just thinking, suppose it ruptures, how long is it going to take to repair it when it's sitting right next to wetlands? That's my issue, you know?
Well, you can think of this, the existing septic system is sitting in groundwater.
Uh-huh. Yeah.
So this solution,
It's better, yeah.
it's Yeah, it's gonna get the effluent 5 feet above that water table.
I notice you have reinforcements at the corners, the angles of the pipe.
Yep, that's required, 1 cubic foot of thrust blocking, you know, behind the bends. Usually these smaller pumps, they don't really need it.
Okay.
You know, but as required by code, we spec it and the guys put it in.
Any other questions? Director, your recommendation?
The commercial property is currently served by a cesspool. A real estate transfer has prompted the upgrade. The building's on a slab foundation, and nearly the entire lot's within the 100-foot setback to the wetland. The proposed septic system consists of a 1,500-gallon monopore 2-compartment septic tank and a monopore pump chamber as required if they're within the 100-foot buffer to the wetland, and they're using a pressure-dosed raised leaching system. The variances are dimensional and environmental, but they are a great improvement over the existing cesspool. I recommend approval of the variances with the following conditions: no increase in flow or square footage to the building, variances and conditions to be recorded at the Registry of Deeds, and no garbage disposal.
Can I just ask a question? This is commercial property, what is it?
Right now, I think they're going to plan to use it as a landscaping company. There's 2 or 3 bays for equipment and an office. I think their goal is to use it as a landscaping business. Yeah.
So they're gonna have chemicals in there, so it's really important to not get in the wetlands.
Mm-hmm. They're not within a water recharge area, so we don't have anything in our regulations to really prevent them from having this type of business here. But they should take good care in where they store their fertilizer and all that other stuff.
That wouldn't be within our purview anyway, would it?
Environmentally, yes. Hazardous waste, yes.
No, I was thinking of the storage of fertilizer.
Our regulations do touch on fertilizer storage in water
okay.
recharge areas, yeah.
Okay.
Do I hear a motion?
I so move the approval of the variance.
With the recommendations the Health Director made.
I'll second it.
All in favor?
Aye.
Aye.
Okay, thank you.
Thank you very much.
And I forgot to say that this meeting is being recorded.
So there.
Have a good night.
Good night, thank you.
Thank you.
And Dan Speakman's here now for
Hearing 130, oh no, sorry, hearing Grosso 287 Bank Street, I open the meeting.
We have a hearing for Grosso, 287 Bank Street, to consider a variance request to install a new Title V septic system prepared by Dan A. Speakman Construction. 2 variances being requested from 310 CMR 15.221, general construction requirements. To allow the top of the proposed septic tank to be 5 feet below grade where 3 feet is allowed. Variance request of 36 inches, and to allow the top of the proposed pump chamber to be 5.3 feet below grade where 3 feet is allowed. Variance request of 2.3 feet.
Good evening, Dan Speakman. We've got the request for these variances for these tanks because the piping existing in the house comes out underneath the basement floor. So there's a bathroom down in the basement. It's an existing situation, so we can't really do anything about that. So we need to accommodate that somehow. And the only way we can do that is to get these tanks down low and get gravity feed coming out of the house. So that's the reason why we're requesting the variance, is to be so deep in the ground.
No audience. Is that it? Do you have a question?
No.
I didn't mean it that way, I'm sorry. And that's you're finished?
That's it, you know, there isn't much more to say about it.
Okay.
I'd be happy to answer any questions.
I close the hearing. Any questions?
No?
No?
No.
No questions? Do I, directors?
The existing three-bedroom dwelling is currently served by a cesspool, so a Title V system is definitely an upgrade. The topography and the existing plumbing do create the need for the variances. The alternative would be to change plumbing using injector pumps and other expensive means. They're proposing to use H20 grade tanks, which can withstand the extra added cover, the fill that will be on top of these tanks. Approving the variances will negate the need for these expensive changes, and the benefits outweigh the negative impacts. I recommend approval with the variance conditions of no increase in habitable space or square footage to the building, the dwelling to be restricted to 3 bedrooms, variances and conditions to be recorded at the Registry of Deeds, and no garbage disposal.
I'll make a motion that we accept this with the 4 variances that are recommended by the Board of Health Director.
Second?
Second.
All in favor?
Aye.
Motion passed.
Start digging.
What kind of tree are you gonna have to dig up?
I'm sorry?
I'm just curious to know what kind of tree you have to,
It's an oak.
oh, an oak?
Yeah.
Well, all right then. I guess
Common.
that's oak. I just hate to see a beautiful tree, you know.
I understand. Yeah, we don't like to take them down unless we have to, you know? Alrighty, well, thank you very much.
Thank you.
night.
Good night.
So the next item on the agenda is the report of the health director. In your packets, you have my annual town report that will be published probably next month or the month after. It goes through all of the work the health department's done over the last year. It outlines.
We thank you for that very much.
Kudos.
You're busy.
We are busy. We bring in $136,000 each year in permit fees, which is pretty significant. And we did decrease revenues by about 7%, and that is a little bit in due part because we had a fewer sewage disposal system permits, and the copy fee went from 25 cents to 5 cents. So that did make a little bit of a difference. We did issue over 500 licenses last year for all of the different categories that we regulate. We had a great bathing beach year right up to the last week in August, where we had a lot of rain and 9 beaches failed in one day. That was the week after Paula left. So I was but
I was
She was
thinking
probably
of
up
you,
there.
too.
yeah, she was
She
okay.
might have
Yeah.
had a hand in that.
They were retested the next day and they all passed. So it was definitely a transient situation.
That's good.
Other things that have happened, we didn't have a meeting last month. We didn't have anything to discuss as far as variance goes. So we had a little reprieve last month. So this month's report's a little bit heftier. Things that we have been working on, we're beginning to update the website for a public health wellness link. That's something that I started and I'm going to have Katie work on. She's interested in community health. So between the two of us, we're going to start updating the website for health and wellness information on
Oh, cool.
healthy eating, exercise.
I'll
So
help you.
yeah, okay.
I'm sending you stuff. I'll send some more.
Yeah. I did order some educational brochures and materials from the Mass State Clearinghouse, it's free publications. Put them downstairs. I have to get together with Community Center and the nurse and the schools to distribute the rest. Different things on substance abuse, on diabetes, high blood pressure, just different categories. Other things, we did officially hire Katie, Katie Tenalia. She's our new senior health agent. Her first day was last Monday. I think she's gonna work out great. She's a very smart lady. I'll have her come to one of these meetings so you guys can all meet her. Let's see. Acela has been acting well. We fixed the
Oh, good.
invoice cloud problem.
Do they still charge you too much for it?
Oh, yeah, oh, yeah.
I don't think that's right. I really don't. I've never heard of a company that did that.
Yeah, the invoice cloud charges the 40 cents per check. Yeah, yeah.
Jeez.
So we have a staff member who's in community development. Her name's Amy Banford, and she's, in addition to her building department secretarial admin duties, she has been working on Acela. So she's becoming the Acela guru of this floor, and she worked hard to get that payment issue resolved. So that is working smoothly again. We did have a public records request for 35 Chatham Road, so Viprino, that was back in our lap last month. He had requested records of his own, so he wanted, that public records request was for his own property. I'm not sure what his angle is, why he wanted them, but he was looking for all emails back and forth, all board meeting minutes, names of attendees, and all of that.
And you sent it all?
Yep, we sent it all per the public information request.
Was that before or after we got out of the case?
After.
After.
That was after. Yep. Yep, that was middle of January. I did go to a community meeting on the comprehensive wastewater management, the sewer plan, back in January. We talked a lot about that tonight, and in your packet is the hookup and construction timeline. So that has a chart of when things are scheduled to start. So if you haven't already, take a look at it, because we're going to be
Big help.
inundated with questions. We already have been at our counter. One of the questions that the homeowners within this area are going to be asked by the construction company is, where would you like your hookup to be? So if your property is, the sewer line's going to be passing by, you have an option of putting it on the north or the south side. Where do you want it? And that is going to mean they're going to be coming into our office to look for where their septic system is. Is it in the backyard? Is it in the front yard? So we have preemptively started a project to pull all of those files and get them scanned and on the computer. So people will have access to them through the Acela portal. So instead of 600 people coming in asking for a copy of their plan, they'll be able to access it from home. And that'll be good for both the homeowner and us, take the burden off of the foot traffic coming in and out. And yeah, and it's not something that's gonna happen overnight because there are 600 files to be pulled, and probably a quarter of them are in the basement. Back in the 70s, they were connected to the building permit, so we don't have all of our files on the first floor, second floor. And then the process of scanning them is time-consuming as well. We have to go to a different scanner, the large scanner, which is in engineering, and have it transferred back to a computer and uploaded. So our goal is 3 to 5 a day. We're already a week or two into it, so it's not so bad, but it's not going to happen over the next month. It'll be several months before that project's complete, but we've started.
Fantastic.
Yeah.
I'm sure I'm not unusual, you know, I have no idea. I'm not neighborhood, but, you know, I call Robert Howard, he comes.
Yeah, they know, yep.
Why do they have to crush the septic system?
They have to crush and fill it for sinkhole reasons. So say you have a
Yeah.
leaching chamber or a tank
Yeah.
and you don't fill it and it gets a crack in it, the soil could fall in and you could have a sinkhole you wouldn't want a sinkhole.
That makes sense.
There was a staffing memo from administration that has been approved in the meantime, but I wanted to make you aware that Jen will be going on March 1st from administrative assistant to executive assistant. It's a little bump in pay and duties, and
Yay.
Congratulations.
yay! They're reorganizing the way community development is operating a little bit. Conservation is not getting an admin assistant. Instead, they're getting a full-time agent
Oh,
who is able to do admin duties. So,
it will be under Amy's
yes,
command?
yes,
Okay.
yeah. Her name's Nikki Smith, and
Yeah, I
she's
met her.
been working a while. She's wonderful, and she's able to do field work as an agent and do some admin duties with agendas and helping at the counter and doing administrative reviews. So, with the removal of a fourth admin up there, they've bumped everybody up to executive assistants. Initially, Jen was going to be both health and conservation, and that didn't really sit well with many people, so that was taken out, and Nikki will be doing conservation. I attended the garden club
Oh.
last week. We had not a problem, but a concern from the garden club that we weren't allowing them to bring in potluck food for their events. And
Oh,
they thought they were being targeted, and why is this law changed and everything?
The newcomers that I sit on feels the same way, and were kind of like being kind of nasty to me about it.
Well, it's not a new law or
I'm
new.
I'm glad to see this in writing, because then if someone
Yeah, it's
asks you.
easier. It's written to the garden club because they asked specifically, but it's good for really any event.
So this could be sent out to somebody if they're, and I'll maybe have some questions for you later, because I co-chair the hospitality committee for the newcomers, and some people bring in pastries as well as coffee, so that may not be.
If they're from a commercial establishment,
No, this is, some of it is,
yeah.
but if it's made at home, like my husband usually makes zucchini or banana bread or something, that's probably a no-no.
Right.
But we need to, I didn't know that, and I think it's good to be proactive so that when different groups like the newcomers, and particularly the gourmet women, are very annoyed by this, and they're basically boycotting having events at the community center because they're allowed to do it in Chatham. So
Right.
it's just a strange little quirky thing.
Yeah, so it's a 2-page info
great to
sheet that
see,
I did
yeah.
for them, and I spoke in front of them, and I didn't get tomatoes thrown at me or anything. Yeah.
Maybe you could even just change the
Yeah,
two, where it says garden club, and just have it
To
generic, and
event,
this could then
yeah.
be shared.
yeah,
That
we
would be
could put it
great.
on our website.
Yeah, thank you.
We did have to send out some written notices for several establishments that didn't renew their licenses by the first of the year. A few have complied by now, but there are still a couple that are outstanding. So these letters went out last week. If we haven't received anything, I'd say tomorrow would be their 7 days. I'll be writing $100 fines for their second offense. Just FYI.
They've been giving fair warnings.
They have been given fair warning. Also in your packet is something from POCA. It's the Protect Our Cape Cod Aquifer organization. They have formally requested to be on the March Board of Health meeting. So they'll be coming with a short presentation in March. But familiarize yourself with what they are and what they represent. They are I'd say grassroots organization that is looking to get support from towns to stop the herbicide use of Eversource when they do the right-of-ways. So for the last few years, Eversource has been using herbicides in the right-of-ways. When when they go forward with this spraying, there's always public hearings and notifications. There is a public hearing for vegetation management, and that is in your packet as well, the date of that. They do it Cape-wide, and POCA is requesting a letter against it, against the use of herbicides.
And to learn more about them, we should just go on the website?
You can go on their website. They do have a website and a Facebook page. It has a little history of them and some news clips and things like that.
Yeah, it's been kind of a big deal in my neighborhood.
Yeah.
My house that I had up until 2 years ago was, the backyard was right up against the area now, 6 houses away where I live. It's further back, but there's a lot of angst in the neighborhood, particularly where children are involved, that this is being done. So I'll get myself informed by reading.
Yeah, they are holding a public meeting in Chatham, I think, in the next couple of weeks.
March 2nd.
Until March 6th. Okay, March 6th.
March 6th?
Yeah, it was on the 1st, and she sent out a revised schedule too, so I'll forward that to you.
Oh, that's good, yeah, thank you.
And there's, I think, a 100-page PDF from Eversource that talks about their plan, so we'll send that over to you guys too.
Why, you don't want to print it for us?
No, I didn't want to print it for you.
This is all in
One
Endar?
comment on that issue. Since their title talks about the aquifer, I presume that's their primary concern.
Yes.
And I'm sure they know, and you probably also know, that studies have been done already that demonstrate that the standard glyphosate that they use does not penetrate into the aquifer. I mean, it doesn't even penetrate a foot. And so, I'm not quite sure what other issues they have, because I've heard people having allergic reactions to the spray and so on, which has nothing to do with the aquifer.
Yeah.
But maybe that's just a headline or something.
Yeah, they do talk about our sole source aquifer in their presentation, so I think that's their angle.
Yeah.
and
Well,
why
that
they come
study's
to
been
board.
done. I mean, it was less than 1 part per million in the aquifer, right over where they sprayed, so.
Well, I'm just talking, the people that are in our neighborhood are up in arms. It's not about the aquifer, it's about where it goes in the neighborhood, and houses pretty closely abutted, so if your kids are playing in that area. And so this is managed, not PACA, but this issue is managed by MDR?
Yes.
Okay, that's good to know.
Yep.
So it's surface, they were concerned
It's
about
surface,
surface.
yeah, and people, one of the neighbors has a garden out there, and so here
Yeah.
he's got this beautiful vegetable garden, and he's got really young kids, and he's like, "Mwah." He
Yeah,
goes house to
herbicide,
house.
Yeah.
Well, they can test whether it's gotten into their garden by looking at their plants.
Oh, I don't want to get into a neighborhood dispute at this point.
Also in the packet is some questions and answers on the Phase 2 implementation.
Yeah.
That might answer some of your questions too. I don't know how knowledgeable you guys are on the Phase 2 and what all the requirements are going to be. So it's something we should
I was
all
kind of
brush up on.
surprised. Maybe I learned this
Yeah.
when we went to the educational sessions last year, but I wasn't really thinking that it was going to be $675 a year in taxes.
Yep, yep.
So the lucky Seward people are strapped with a $500 bill, and the people that are in West Harwich
Get a tax.
get a tax of $500?
No.
Get a tax of what?
I think it's $150 a year.
Yeah, I think if you take if you look at the average Oakland house, it's $350,000. I think it comes out to be about $355 a year tax on that.
On top of their property tax, they'll have an additional sewage tax.
Well, it'll be part of the property tax, but it'll increase it that amount, yes.
Well, that's not so bad. It's right here. It's
Well,
quoted saying $675.
that will only be on people that aren't sewered?
Right.
Everybody that's not sewered.
Everyone. Yeah.
Yep.
And why are they getting taxed?
They're getting,
Well,
so it's basically, they're getting a point on their taxes? It's 1%?
Yeah. You know, if you're suing the whole town, the common way to do is through betterments. You know, you pay for what you have, and it's based on whatever, you know, your frontage or the size of the house or something. We're in a bit of a unique situation in Harwich, and most towns on the Cape, Chatham being the exception, is that we're only sewering about half the town. And we're doing it to clean the water up. And that means there's not really a lot of choice. You can't put it all on just those that are sewered. Because one issue is a fairness issue. You know, Frank, you and I could literally live, you could live across the street from me, and if mine's the last home that's needed to be sewered and get rid of the required nitrogen, I'd have to pay for it, and you might not have to be sewered. And
Makes
so
sense.
It was hard to see how you would do
Yeah.
that, unless you put it on the property tax, because the idea is that, you know, it's just not preventing, it's not protecting the health of your sewer. We all benefit by having clean waters, maintaining our abatements. So
And you gotta come up with the, you know, whatever it is, $500 million, some way.
Yeah,
Yeah.
so everybody gets a tax.
And so we, you know, spread it out that way. The,
Equity.
You know, the homeowner will have to pay for, obviously, their connection. The O&M cost to keep the sewer going and maintained, that will be, in our budget this year, Chris has put in $100,000 to start probably an enterprise fund. Because again, you know, the first year, for instance, we're sewing 600 homes, and it takes us 3 years to do it. Let's say the first year we get 200 homes hooked up. You're not going to have those 200 homes pay the entire operation of the sewer plant. You know, they're going to charge them maybe $500 a year or something. I think what Chris is, based on the flow, maybe they get a charge, which won't cover it. So some of that will go back to the overall property tax as well to make it work. Otherwise, you know, it's not feasible. So it'll be a transition phase going forward.
Makes sense.
Does that make?
Yep.
Yeah.
Frank,
Yep.
did I help answer that?
No, I get it.
I probably
That,
said
no, that hasn't
I
changed.
probably said too much.
No, that hasn't changed.
It's
It's
all,
been a long time standing thought.
Well, I
To
think
share
the
the
interesting
equity.
part to me is that people, when it first came out, I think they thought the property tax was going to go up like $10,000 to $20,000 a year. We're talking big money. But we're talking over, I think the way the state works now, we'll probably get a 30-year loan. And if we're on the top of the list for a state revolving fund loan, which we have a good chance of being, not zero, it doesn't work that way, but less than 2, maybe 1% or so, over a 30-year period. And then we'll add the next phase, you know, it's a 40-year program, 70 years if you count all the, obviously I'm not gonna see it. And so the annual.
No, they build out the plant and things like that. It's a 70, yeah, it's a 70-year
Well,
plan.
we're hoping right now to, make it tell me to shut up, I'm going too far.
No, you're doing fine.
No, yeah.
I depend on you. I don't mind being told to shut up. We're working also with Dennis and Yarmouth to build a regional sewer plant right now. Dennis can also save us money. So we're looking at cost savings. And we'll see, but it's an expensive project. It's not good around it. But we're hoping to spread it out over time. I think if you look at the 40-year period, it's a peak of that. Again, the average home was 355. I think the worst year is on that aspect of it, maybe about $450. You know, the first phase in the U.S. But quite frankly, it's a rough year for us. Because you look at Sackatchewan and Harbor, you look at the Cape Cod Tech, you look at the fire station. We got a lot of stuff coming in, and
Spendy, spendy, spendy.
Spendy town.
Yeah.
It's tough, but, you know, I don't know how we, I mean, for me, I'm real strong supporter of Cape Cod Tech with all the stuff we need there, and there's something, we need the fire station, and that's been on capital list for probably, I don't know, 10 years, maybe, next year. Next year. So, you know, it's gonna be an interesting discussion, you're right. I don't like it, but I don't know what to do about it. So, and do what we're supposed to do.
Suffer. One word.
More food for
Look
thought.
at it this way, it's only one beer a day. I'm tired of one cup of coffee a day.
Right. You can move to the city and these bills will seem small, right?
Well, that's an interesting discussion because, we all neighbors from Canadian, New Jersey, our taxes, nothing. That's
Nothing.
not the baseline we look at. The baseline we look at is people come to here with fixed income, you know, so can't compare it to anywhere else. You gotta compare where we are now.
Well, thank you.
Thank you.
It's been very
That's good.
informative.
That was helpful.
A couple other things I wanted to bring to your attention was a letter of support that I wrote on your behalf to the Department of Housing and Community Development for a community development block grant for
Good night.
Fantastic idea.
Thank you.
Thank you.
Thanks for coming.
Thanks, Larry.
the Department of Housing and Community Development they have a program to offer childcare vouchers to low to moderate income residents, and also they provide some housing for low to moderate income families. So they have applied for a grant to do work in Harwich, and this letter of support just supports the grant. They haven't received the grant yet, so this letter of support was something I did.
Thank you.
And then the other thing I wanted to tell you about, or to get in the back of your minds in case the town does not outright ban marijuana sales, if they do allow some marijuana sales, zoning is working, planning is working on regulations for time, place, and use regulations. They may be looking to us for our own set of regulations as far as retail sales of edible types of marijuana. So it's something that the Board of Health has to be involved in. And then also, we should look at it as like our tobacco control regulations, as an inhalant. Are we going to limit that as well? So there is some questions and answers on that in your packet. So I don't have a whole lot of information on it because honestly I haven't looked at it because it hasn't been a need just yet. But coming up, we'll need to know if we have to be involved or not. So just look at
I
it.
have a
I
hands
think
full.
they're kicking it off, right?
It's got to go to town meeting in May.
No, I mean statewide, July.
Yep, the Cannabis Control Commission, I think, said July. So, we got to think about it,
Sure.
okay?
It's going to be tough because cannabis in food, I don't know of any way of testing for amounts
Yeah.
yet, you know?
Yeah,
And you don't have
Just
the.
your reaction of the people who took it.
You don't have the person power, I won't say manpower, to be sampling Alice B. Tokeless brownies, for example.
yeah,
Yeah.
yeah, it's not only that, but it's,
They'll figure it out on a state level. It's not
Yeah.
gonna be ours
But
to
especially
figure out,
with
because
driving,
it's gonna be all,
the poor police.
it's all gonna be state regulated
Yeah.
and tested on a state level, not a
Well, then we don't have to,
municipality.
we
Good
don't have to.
that's
add
what I'm
anything.
hoping for.
Yeah,
That's what I'm
Yeah.
hoping
I
for.
hope you're right.
But they didn't do the 21 for tobacco use on a state level. They let all the locals do it, so,
Different.
yeah, I
And
hope so.
there's a lot of money involved.
Mhm,
So
mhm.
they're gonna keep it on that
See what Charlie Baker does.
state
Yeah.
level.
So that's my report for January and December.
Did we ever have,
Very thorough.
Very
did you
nice.
ever get any feedback from any of the community groups or different towns on the Cape about applying to that Mass Food Trust grant?
No, I did not get
And
any
I know
feedback.
somebody who told me, somebody said the date was moved back, so I think that
Oh.
the new date is this spring, but I really didn't look into it. I didn't know if anybody had communicated with you that they were thinking of applying for it.
No, I didn't get any feedback. I have been forwarding your emails to Eric Beebe over at Recreation about the other types of grants.
Pretty much walking or, yeah. physical activity?
Physical activity,
Okay.
yeah.
Some of those things might be, not the grants, but some of the other things might be some of the things you might want to put on the website.
Yep. We have a permit list that needs to be voted on.
I already put it away, but I did look.
We don't have any new food or new stables.
Aren't there a couple?
Oh, yeah.
Yeah.
2 new residential kitchens. They're limited food service, cakes for all occasions. She does cakes out of her house. And Elixir Confections, same thing. She does non-potentially hazardous foods out of her home. So those were limited food service permits that are new. They've been inspected, and I don't see any issues with them.
I'll make a motion to accept the permits as presented.
Second? All in favor?
Aye.
Permits passed?
Can we go back to the influenza thing just a minute?
Mm-hmm.
Anything late breaking on influenza B in town, or rates, or any kind of feedback? Because I know in the news tonight, I mean, there's been more than this thing, but there was a father and son who died from influenza B. And there's been other cases in Massachusetts, so I didn't know if there were
I haven't gotten any new
any
alerts.
policies from the state, anything locally, or?
Nothing since the alert that I have in the packet, saying that there's a rise in influenza.
Oh, the hospital's full.
Yeah.
Yeah.
My doctor's been sick. They've actually had us pray for primary care providers at church last weekend because so many of the primary care providers are getting sick.
Yeah. Yeah, we haven't gotten any alerts as far as nursing homes or anything like that having
Liberty
outbreaks.
Commons and Chatham had to close,
Did they?
and so did Eagle Pond, Dennis.
Yeah,
But they're both
nothing yet.
open now.
Yeah, I didn't know if I just got an email from a colleague of mine who's saying that 2 of their very dear friends died.
Yeah, the people
And they're in
died.
their, so these are people in their 60s.
Wow.
And it was that they didn't seek medical care. I mean, you think you have the, whatever you think you have,
Yeah.
just a cold, a bad cold, or blah, 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 blah. But to have people dying from it is kind of alarming, obviously.
Yeah. And even though they say the flu shot's only 30% effective this year, it's still 30%
Isn't
more.
that for A, though? Isn't the problem now B?
The problem now is B,
B,
but
but-
I thought the flu
Even
shot
A was
also.
only 30%.
Yeah. The last thing is a discussion item. We had a request from a resident who said he would be here tonight to discuss bed bugs. But I will read you his letter.
Okay,
We got a copy.
You got it.
Okay,
We
you
don't want
got
to be
a copy.
discussing this too much in detail before we go to sleep ourselves.
Yes, so his concern was that he moved into an apartment and found a bed bug. And he's concerned that the town doesn't have enough public education on bed bugs, and possibly that he would like some education for landlords on the issues of bed bugs. And I responded to him saying we get maybe 1 bed bug complaint a year. It doesn't mean it doesn't exist in town by any means. But when we respond to a bed bugs complaint, we do enforce pest infestations and have the landlord deal with it. And I reassured him that bed bugs can't transmit diseases. They can make you itch and scratch and give you some skin irritation, but they're not going to spread disease in that way. They are a pest, not so much a public health
They don't carry
hazard.
Nika.
They carry what?
They don't carry Nika.
No, no. So I'm not sure really what we can do aside from providing a link on our website to the
They're very hard to
CDC's.
eradicate
They are.
because they hide in furniture, and they also hide in the walls.
Right.
And you have to have a professional exterminator. You can't just spray DDT or whatever on them.
No, and if they're multifamily units, you can't just bomb the
Yeah.
unit they're in, because they just spread to the next one, so. And there are great documents from Mass Department of Public Health and CDC on the best practices to deal with them, so we'll put a link on the website, but as far as doing a mass mailing, I'm not sure how to even identify all the landlords in town. We don't have a rental program or anything like that, so.
Well, plus in this day and age, I'm not so sure that that's cost effective to do that. It's something, some kind of message on the, and information on the web is the way to go.
Yeah, because it's not exclusively a renter's issue, you know, it can happen to travelers in general, not just renters.
With all the Airbnb stuff,
Yeah.
absolutely, it's an issue, and it's nothing new. And all of the rental companies are up on it with their clients. I know that.
That's
They're
good to
they're
know.
aware of it, afraid of it, and there's not a lot you can do preventatively for it. You get it and you have to deal with it, that's all.
Maybe having one of the fact sheets out in your things out here, the slot things.
Yeah,
But I think the web is the way to go, but there may be some people who are
We're
not.
gonna run out of
literate.
slots.
Yeah,
yeah,
well, all the new prevention and wellness stuff.
yeah, we're getting on that.
Yeah, okay.
That's all I had.
Okay, somebody want to make a motion to adjourn?
I'll make a motion to adjourn.
Second.
Second,
Okay.
third, fourth, that's a wrap.
Oh, I should get our next meeting is, let me just see.
Good meeting.
Thank you.
You're welcome. I'll keep you all up to date on the
The
sewer.
big problem in
Oh,
Boston, having lived there.
Oh, yeah.
What
Our
are
next
your,
meeting is when?
March
13th.
13th.
Yep.